A dilapidated economy has its effects on multiple sectors. At the moment, healthcare administration and the medical system are compromised.
We are having cases of pneumonia that were totally treatable that are killing kids and adults. We're having people who have wound care issues. You can't treat their wounds.
Not being able to afford the cost of drugs is an issue that some Kenyans relate with quite well.
Unapata kwenda kununua dawa bei iko ghali ambao hatuwezi kuyamudu.
How do we make sure that anybody who needs antibiotics, when they go to the shop, they get the full dose? You can't buy 2 or 3. It is packaged for the 14 days or the 7 days.
Dr. Lucas Nyabero, a pharmacist, warns that antibiotics failure poses major risk to a patient's health, especially when he or she buys medicine without a doctor's prescription. In addition to the misuse of drugs, how society members dispose of unfinished and expired drugs at home or even in shops contributes to the workability of drugs in the body.
People who take half the medications, then they toss them, and some of them put them in the pit latrines. So that goes into a water table, so we drink that.
While proposing some solutions, Dr. Nyabero has asked the government to better its research and development system and create a digital platform to accommodate records of health and treatment background of Kenyans.
If, for example, you come from Kisumu to visit Nairobi and you get a bacterial infection, we should look and say, what was in Kisumu and what worked there? We start with that medication and change if we need to.
Dr. Sylvia Gashoka, an expert in infectious diseases, warns that apart from death, disability, and long-term hospitalization, the financial effects for the victims after the lack of suitable medicines are huge. Ben Kerera, K24, Nairobi.